This is Sickle Cell and the Mind, a mental wellness podcast, brought to you by the European Sickle Cell Federation. It's time to reduce social isolation and create new pathways to mental wellness together. You're listening to Sickle Cell and the Mind, a mental wellness podcast, with your host, Leah Lewin.
We are here for episode 7, the Dread of Hospitalisation. With me today, I have Funmi and Hayley, and we're going to be having some really raw, interesting conversations around the impact of mental health when it comes to hospitalisation. So, Hayley, if you'd like to introduce yourself, tell us a bit about you, why you decided to join us on the podcast, before we head into the questions.
So I'm Hayley, I'm mum of 3. My eldest, Sienna, who is almost 17, has sickle cell anemia, and I also run an organisation to support children that have sickle cell.
Lovely. Thank you for joining us. And Funmi, if you could introduce yourself.
Hi, I'm Funmi. I have sickle cell anemia, so HBSS. I live and work in Oxfordshire. Decided to take part because I just thought it's a conversation that's long overdue.
Yeah, that's very, very true. Okay, so Hayley, you said you are the mother of someone with sickle cell. So I want to kind of kick off with you and just find out what the impact is, the emotional impact that comes up when you think about hospital visits for your child. Is it an anxious time? What sort of mental health kind of precautions and things you put in place? Tell us a bit about that.
So for me, I think as a parent, you kind of are always just running on whatever fuel you have left, kind of thing. So when I know that Sienna needs to go to hospital, I think the kind of roller coaster of emotions is me just trying to get her to a safe environment is like my priority. But then there's always the anxiety of, are we going to have a battle when we get there? Are they going to follow the protocols correctly? Am I going to I don't want to use confrontational, but am I going to have to advocate for her to the point where I'm being seen as difficult, is a word that gets thrown around a lot. So, yeah, I think anxiety, fear, stress, but I think most of that experience is just worry. I'm scared for her, what the outcome of that admission is going to be. And then also, as a parent, you have to suppress your feelings, which sometimes during that admission, can lead to you feeling a bit broken. Because I don't want her to ever see me vulnerable when she's in that situation. I want her to see me strong and ready and prepared to advocate for her.
Yes, I hear and agree. I'm going to go slightly off a little bit there because something you said has really resonated up here, and it's the idea that we have to always be strong and not show vulnerability. But do you think that there is any way, and there's no right or wrong answer, there is any way that you can kind of find some sort of shared vulnerability which enables you to show Sienna that actually these feelings of fear, it's normal, it's okay, and you don't always have to put on a mask? Because for us to be able to access help and get support, especially when it comes to your mental well-being, sometimes we need to remove the facade and we have to take off that mask. Do you think that's something you feel at this stage in your journey you could confidently say, actually, if I took my mask off and I was vulnerable in front of Sienna and healthcare professionals, do you feel you'd be supported?
So I think those are two very different things. So with Sienna, I try not to show that I'm scared because then she worries more, which then I feel impacts what she's experiencing. So, and that's, I think, very individual. Sienna's very much, she's very sensitive in, she kind of bounces off of other people's emotions and things. So I know if she saw me sobbing, she would absolutely freak out. So I've had to kind of take myself away from her, have a little cry, come back composed, because I don't want to add to whatever she's already going through. Um, but in terms of healthcare professionals, I don't care whether they see me crying. I don't care if they see me angry, whether they see me, because at the end of the day, I'm only human. And
Yeah.
when you see your child in a vulnerable position when it's their life, um,
Mm-hmm.
I think, yeah, everything just goes out of the window from other people, kind of other than my child.
Yeah. Thank you. And for me, what are your thoughts? How do you think the hospital visits and admissions, how does that impact you?
Um, I think for me, it's really a mental battle to actually just pick up the phone and call and just be like, okay, I've got to the point where I've tried everything at home, you
Mm.
know, I've prayed, I've talked to everyone I can talk to, I've tried every strategy, and I'm like, nothing has worked. And it's just that um disappointment feels like a light word, but I guess, yeah, disappointment and just, oh my gosh, are we really here again? Like,
Mm.
is it that time again? Like, do I really have to go in? Is this really necessary? So I think for me it's just dread. I think dread is the word that I would use. I think that sums it up quite nicely. I think that, like, I don't know what am I going to face when I get there. I can only go off past experiences, and past experiences haven't always been great. So I think that moment where I need to go in, it's just, I would give anything in that moment for, I just want to be well. Like, I just want to be fine. I want the
Mm.
pain to go away. Yeah.
Oh boy, that resonates hard right now. So yeah, yeah, I definitely hear and understand that. It's really difficult. I think, especially because the people around you, they'll always encourage you to just go in, even if it's nothing, like just go in, be seen, make
Yeah.
sure that everything is okay. But it's the fear of, if I go in, am I staying? If I go in, am I more at risk? If I go in, am I going to be heard? And am I going to be listened to? Do I
Mm,
have to advocate for myself, or in your case, for your daughter? Are people going to recognize me as a person outside of this disease as well?
mm,
Um, or am I just a patient with sickle cell?
mm,
Am I still going to be me? Um, and that's, I think, that's a huge battle, and an element that impacts mental well-being that I think is not always considered,
mm,
because the main thing is to preserve life, to make sure you're well, but actually sometimes for us it may not be to just be well, it's to have quality of life as well, which is very restricted and very limited.
Can I also add something to that, which is something that I don't necessarily experience as much anymore,
Mm.
but definitely for the first, I'd say, 12 years, um, it was overcoming the guilt of seeing Sienna being affected by a condition that she inherited from me.
mm,
So
Mm.
anytime she experienced any symptoms, I felt overwhelmed with guilt all of the time.
Yeah.
Um, and so it's taken a long time. So for parents with younger children, they may still be experiencing that as part of the journey.
Yeah, thank you. I appreciate you sharing that. So, outside of that, are there any specific aspects of the hospital stays that are particularly distressing for you? I mean, none of it's a positive experience. None of it is nice and comfortable and a happy memory. But are there any elements that you find particularly distressing when you know that Sienna is going in again for another admission?
For me, it's if we're at the hospital and she still experiences excruciating pain, I find that infuriating, because the whole point we're going there is to obviously make sure that she's safe and to receive treatment, but there is absolutely no excuse for her to be in hospital and still be in excruciating pain. For me, I just find it yeah, and that's the most frustrating part is when we get there, I just don't see why she's made to wait a long time. This isn't every time, but yeah, I find it really distressing as a parent to see her just suffering so much and being watched by healthcare professionals.
I think for me, if I'm needing to go to the hospital, I basically got to that point, I would say, like physically, mentally, where I'm just done. Like
Yeah,
I'm
you've
done. I've
exhausted
tried,
every other option.
yeah, I've tried it all. It's not working. I've come to accept that, okay, if I want to get better, this is where I have to go. I think for me, the waiting around in hospital is really frustrating. So like just the procedures, okay, so you come in, they ask questions, they clock you in, they take background, they take history, when did this start, so on and so forth. So I think for me, all of the waiting in between, waiting for painkillers, I think that's really distressing. Or where, you've been seen by a doctor, they prescribe the pain relief, then you start to feel better, and then like it wears off, and then you're
Yeah,
like, well, where's the next dose? Actually, my pain was getting better, but now it's getting worse because you haven't given me this painkiller in time. So I think for me, that's some of the most distressing parts of an admission, I find.
yeah, yeah. It's very true. Um, and Hayley, I'm going to ask you a difficult question, but that's why we're here to have these honest conversations. And if you need to take a moment, then please do. But how do you cope with seeing your daughter in the hospital? Like, how does that impact your mental health? How does it make you feel?
Um, Devastated, I believe, is a word that may come close. Um, like I've said, there's probably 3 or 4 times where I have literally just broken. One was when Sienna had her spleen removed, and because she'd had hyperhydration before surgery, her lungs ended up, I don't know if I'm going to start crying.
It's okay.
Her lungs started filling with fluid after surgery, and I remember just loads of people rushing into the room. Um, and I didn't think that she would come back out of that hospital that day. And I don't think I realised that I was experiencing trauma as well,
Yeah.
because it wasn't me. Sorry.
It's no,
I don't
don't apologize.
as an
Please don't
example because,
apologize for what you're feeling because
yeah,
vicarious trauma is just as impactful as first-hand trauma. And you
yeah,
can't negate the fact that's your child, that's someone you brought into this world and vowed to love and protect, and seeing them in pain or in harm's way, it's not easy, and it's not a one-time thing. It's not like a broken leg or something that is fixed and you move on with your life. It's something that's reoccurring. So please don't apologize for how you feel and the experiences you've had at all, ever, for anyone.
thank you. I think for parents is your one job is to protect your children, and when that is removed from you, and you pass the baton on to healthcare professionals to,
Mm.
yeah, protect your child's life.
Yeah,
Um, it's a very scary place to be in.
yeah,
But even things like Sienna having to be held down because she was scared of needles, and everybody expecting her to be fine with needles because she has to have so many blood tests and so many cannulas when she comes in.
mm,
And it used to just frustrate me because she was terrified, and then she'd have to be held down, and it was just,
yeah,
yeah, putting her in a position where you want the best for her because they need to know, they obviously need to do the blood tests to check to make sure her hemoglobin levels are going up and things, but
mm,
at the same time she's so terrified,
yeah,
because something is happening to her body that she doesn't want it to be done. So yeah, as a parent, I think it's the worst thing you could ever experience is seeing your child just going through the worst
yeah,
possibilities. I think overall, yeah, it's just terrifying, seeing your child and not being the one that can protect them in those circumstances.
mm. Do you have any fears around the fact that in the UK, the healthcare system is very Eurocentric and sickle cell is seen as a Black person's disease. And there's still very little knowledge about it. And sorry if I'm going off topic slightly, but do you have any fears around systemic racism when it comes to the care of your daughter?
100%. And it's something I have to talk about so much because she's now transitioned from pediatric to adult care. And for me, I don't think she's aware of how much things are going to change for her. And from kind of the organization that I run, the amount of things that I have to deal with supporting parents because their teenage child, I think it particularly for males, they're stereotyped a lot when they're in pain and they're irritated. They're accused of being aggressive and those kind of things. Those things don't happen with people that don't look like them.
Yeah.
So I feel like the older she gets, unfortunately, the worse it's going to be because I'm not allowed to be there all of the time with her. Like in pediatrics, I can stay over, I can be with her 24 hours while
Yeah.
she's admitted. In adult care, those things are not allowed. And so for me, yeah, I really worry because it's so evident. And I know there's a lot of reports and things, but we've experienced it firsthand. And I think every single person that we support in the organisation has experienced it as well. So it's not just statistics on paper; it's lived in experiences.
Yeah. Yeah. Thank you for sharing that. And like it's really heartfelt as well. I want you to, I'm going to go over to for me in just a second, but I want you to just take a moment to just ground yourself and take a few deep breaths because I know it's your lived experience, but sometimes when we're talking about it, it can, as you've seen, like really stir these emotions. So I just want to say thank you from me, but also from the viewers for what you've just shared. And it's definitely it's hit in the places, but it needs to be emotive for people to understand the pain and the experiences that people have, and how it impacts every element of your life. It's not just on the flare ups. It's not just when you're in crisis. It's an ongoing everyday life. Um, for me, I wanted to ask you how how do you find communication with medical staff? Advocating for yourself, we've mentioned, and I saw when Hayley was talking, there are a couple of times where you're like, yeah. How has communicating with healthcare providers affected your own experience? Are there any moments or very particular experiences or admissions that have gone extremely well or maybe badly because of lack of communication? What's been your experience?
I think for me, communication links very closely with trust. So if I'm in hospital and you're coming to me and you're like, oh, sickle cell, I've never heard of that before, or when like how long have you had it? Did it just start? Immediately, yeah, I'm like, oh my gosh, I'm about to die in this place. Like they're about to kill me in this place. They don't know what sickle cell is. Like, so I'm having to educate you. I'm telling you about the
And you're
condition.
supposed to care for me.
Exactly. And I'm like, mm-mm, mm-mm. So I think, yeah, them ones where staff don't know about sickle cell or it's very clear they know very little. I think for me, it kind of just makes me feel very uneasy, uncomfortable
Yeah.
about what's going to happen while I'm under the care of these people. If I think about admissions that have gone really well, simply, I've just been listened to. I've been listened to. It's been a partnership. We've gone back and forth. We've negotiated where we need to. The doctor's checked in. We might have a particular plan. Okay, we're going to try this painkiller. Then we're going to wait a bit. We'll review and then we'll come back. If it doesn't work, then we can maybe think about this. How do you feel about that? Or even some admissions where, like, I think for me, the biggest thing about going into hospital is knowing that my plans that I have for the week are going left. Like it doesn't matter what's in the
Mhm.
diary, it's just going left. So when I go to the hospital and I'm like, I don't want to stay, and the registrar's like, I hear what you're saying. Okay, they're trying to work with me. Okay, then I'm like, okay, this admission is looking a bit more
Yeah.
positive. Partnership, very important.
Partnership. That's, please, guys, take that away. Partnership, because
Partnership, yeah.
it really does help you to manage your expectations as well. Like,
Mm,
if you know
mm.
you're not having to work, and not only are you going through a crisis, you're feeling pain, but it's an uphill battle because you have to either educate or beg, steal, and borrow to be heard. Do you feel like you go into the hospital with that expectation of forming those partnerships if you're seeing someone new, if you're in a hospital that's maybe not in your area, and those sort of things, whether it's sudden or an expected admission? Do you feel like you pre-plan strategies before you go in, or do you just succumb and plan to um, succumb to whatever's about to happen?
I think I have to plan. I have to mentally prepare. And I think in my mind, I'm like, for me, just keep your cool. Whatever happens, yeah,
Mm.
just, don't go ham. Just be respectful, be kind, be patient. It's your middle name. Just be easy. And it's very hard to do when you're in that amount of pain. So I'm
Yeah.
constantly having to kind of talk to myself, okay, for me, yes, this is not right, but XYZ. So I think there's a degree of mental preparation that goes into every hospital admission, whether planned or unexpected.
Mm. Yeah. Did you just say your middle name is Patience?
Yeah, it is. Yeah,
I heard you drop that in there.
it's just I get blame my parents. I question every day.
No, it's like a constant reminder, though. It's a constant reminder.
Constant,
Shaking your head.
constant. Yeah.
But it's important because, especially if you're going in by yourself,
Mm,
I guess that's the burden you're now facing, Hayley,
mm.
isn't it? That you're moving from, you were the carer and you were able to, as the parent, be there, but now it's very much Sienna is in Fumi's situation where she's having to maybe make these plans. And yes, you can plan ahead and talk about these things in advance, but what about once you're in there? And then also, quite importantly, which again, I'm not trying to negate the experience in hospital, but then the aftermath of this is something that people don't always take into consideration. When it's time to leave, when it's time to go home, people often think, oh, you're out of hospital, everything's good, back to normal, back to reality. Let's get back to where we were and pick up all the things that we were doing before. And actually, after a hospital admission, I mean, I've just come out and it's taken me a week to recover. And I think people think that, oh, you're out, it's cool. What
Hmm.
do you think are the main misconceptions that you experience, or you and your daughter experience, when you're faced with coming out of hospital?
So, firstly, lack of sleep whilst you're in the hospital is wild. So, for me, obviously, I'm kind of woken when the nurses come and do our obs anyway. But obviously, Sienna's being woken. And so for me, I think lack of sleep and just kind of getting over the mental kind of aspect of her being admitted and just having her home safe and that relief is what I go through. But for Sienna, the lack of sleep, and then she would have been traumatized as well by the experience, particularly the last couple of admissions have been on her chest. So she's been struggling to breathe, which for her was terrifying because there was nothing that she could do or anyone could do to kind of relieve that feeling of not being able to breathe properly. So it was almost like she was constantly being suffocated for days. That's how she felt. And then you're on a cocktail of really, really toxic medications. So, particularly morphine, it can take so long to come out of your system. And then, yeah, those things can cause other complications like constipation and all of those other things that you then have to deal with. So sometimes it can take Sienna a good 2 weeks just to even get on the cusp of normality after leaving hospital.
Yeah, yeah. Oof, this conversation, boy, is the reality of this is, yeah. And I think it's not just a story. We're not just using example. These are everyday lived experiences. And that may sound shocking and unheard of and like a one-off thing for people, but this is not new. This is not new at all. And
No.
I think that's the point that I want to drive home, that this is a continuous life experience. This is how the journey goes. And it's
Yeah.
really, really difficult because not only have you then got to think about, are you going on laxatives? Are you going to need to have a period of time to rest? What about work? How is it going to impact financial stability? All of those extra things. Have you got to make sure that all of the things that weren't done are done? Has the house been cleaned in the past 3 weeks that we've been going through this? All of those little things build up, and the impact it can have on your mental health is underestimated.
I
Coming
think
out,
also,
sorry,
sorry, one thing people forget as well is if you have other children, that even though they may not be with you in the hospital, so for us with Sienna, them not knowing what's going on, when they'll see me, when they'll see Sienna, how she's doing, all of those things, especially when they're younger, their little heads are ticking over and they're terrified. And so when people say, when my son was, I don't know, I don't want to, out him, but when he was at an age where he probably should have been in his own bed, I just said to people, you've got no idea what he's been through. He's been through way more than any other child that I know, just from having to be a bystander of all of this stuff. So if he feels safe and he feels like he's not going to wake up and mum's having to 3 o'clock in the morning think about rushing Sienna to hospital, but getting him somewhere, someone to look after him as well, or him having to sleep on the end of the stretcher in A&E or whatever. Um, yeah, I feel like siblings also kind of forgotten about the impact that it has on them.
yeah. And for me, what do you feel like you have a stable support system that can kind of help you when you're navigating these types of things? Because as an adult experiencing this, you it's more of an independent experience. Do you have a support network that can help you navigate your hospitalizations and the aftermath? And is there any tips that you'd give that are really, that you found are really helpful or in fact unhelpful, from those that support you?
I think the older I've got, the more I've realized that actually I can weather any of life's storms if I have a good support system. So I think lessons for people, you have to be honest. Like you have to tell your friends you have sickle. You may not want to tell everybody, but at least one, two that know what the situation is, that know where you are when you don't show up or why you don't show up. So I think for me, I think I feel very privileged to have a great support system, friends, family. My church community have been amazing, from like taking me to the hospital, bringing me foods, staying with me. Yeah, I think support is definitely needed. You can't do life alone, full stop. Like regardless of sickle. So even with sickle, it's that bit much more harder. So I think for me, community support systems are everything.
Somebody once asked me, as a parent of a child with sickle cell, what is the one thing that you value the most? And I said to them, of all the times Sienna's been in hospital, I've only had one or two friends ever come and visit her, and they're the same one or two friends. And people always say, oh my gosh, I've seen Sienna's in hospital. If there's anything I can do, let me know. Then I'd say to them, oh, do you know what? Could you come and sit with Sienna for an hour? Like I could really do with going home, getting some clean clothes, getting her some stuff. Oh, sorry, I can't. I'm busy. Nothing. Well, why offer? And I'm not a person to really take up on people offering help. So when I do, it's because I really need it. Um, and
And
so,
then you
yeah,
regret.
I just feel like don't offer if you're not actually going to do it.
Yeah, yeah, that's true. Do you feel like because of past experience, you've learned patterns in behavior or any particular lessons from either yourself, healthcare professionals, or your community, and how they respond to you from your past experiences?
Um, I don't tend to ask people for stuff anymore. I have a very, very small circle of friends because of what's happened in the past. And I have to say, one of the most memorable things a healthcare professional has done was Sienna was in hospital on my birthday, and they said these student nurses were caring for her. And I said, "Oh, Sienna, you're not going to make my birthday cake this year because you're in here." And the next day, they brought in cupcakes for her to decorate for me and surprised me. And honestly, I can't tell you just how nice it was. They've gone above and beyond. And it's just those little things where I think you were meant to care for people, like it was your destiny to become a nurse because they were just so lovely. So I just wish that,
Mm.
yeah, healthcare
Yeah.
professionals, I know they're under a lot of
Um,
pressure, but just that humanity and empathy aspect, it goes
Mm.
such a long way.
Mm. Yeah. Yeah. And I
mm,
think those are the experiences that no matter what hellish kind of trauma you were having in that moment, they make it a little bit easier.
mm. Yeah, I have to echo that. You know, similar sort of experiences. I want to shout out my my former specialist nurse, Sandy Hayes. She's now retired. I'm very sad. But yeah, let's clap for Sandy because the amount of admissions I've had where she's come, she's, put things right, she's sorted out my pain relief. Sometimes she just sat with me or we just talk about everyday normal things. We banter, we laugh together. Like, yeah, I think those nurses who go above and beyond, they really are godsends. They really are godsends.
I have to say that the last admission Sienna had, it was probably her last admission for pediatrics. And it was the first time that I could remember the peds doctor coming down and being like, "What do you need? Tell me what works best for you. What can I do for you? I'm going to check this, I'm going to check that." And I was so shocked with how smooth sailing the whole experience was that it made me stop and think, it should be the other way around. Like, it shouldn't be a surprise that somebody's willing to listen and willing to let you guide them because you know your condition better than anybody else. You know what works for you. And I have to say that that team that night, I appreciate them so much
Yeah.
because it was a pretty scary time for Sienna, and just that she felt safe.
Yeah.
Mm,
And I was just like, wow, I loved it.
mm,
Thank you. Thank you. I mean, I feel like we could keep going for far too long, but and these stories need to be shared. It's really important that we keep speaking up and we keep speaking out and we help to be part of the education, and that it's not just out of a book, it's not just clinical information, that it's lived experiences so people get the full picture and understanding of these various experiences. One thing I would like to ask you both is, if you were to be reflecting on improvement, what is one thing that you would change about sickle cell patients and their hospital experiences? If you could, if you had a magic wand and you could change one thing about the system to improve your experiences, what would it be? Hayley, I'll come to you first.
A&E,
Yeah.
a complete overhaul of how patients are treated in A&E. For us, it's not always been bad. We've had some great experiences with A&E,
Mm,
but the attitude with receptionists needs to be stopped. If you've got an open access letter or you've got a healthcare plan, it needs to be read, it needs to be understood, it needs to be followed.
mm,
Um, there should be nobody waiting in A&E for hours with no pain relief.
yeah.
In fact, it's completely against the clinical guidelines.
Mm,
And so, yeah, I think just pain relief mostly, but I think the process throughout A&E is just not particularly ever great.
mm. Thank you. And for me, what would you, with your magic wand, what would you
there's so many things to pick up on, but I think you said one right. Oh man. I would say just listen. Like just listen to the person that's in front of you. Like, they've been here before. They don't want to be here. They've been here before. They know what works. Work with them. Just listen, treat me like you were a family member.
Yeah.
I'm not just a statistic or just someone looking for drugs or just someone in a bed. I don't want to be here. I really don't. So, yeah.
Thank you both. It's been an absolutely wonderful conversation today. So from the viewers and myself, thank you so much, Funmi and Hayley. Please do keep these conversations going. Please do continue to lean on and educate your community, your families, your friends, and keep spreading information and support with as many people as you can. It should be an everyday conversation. People need to be aware of the impact of sickle cell on mental health. And we will see you again in the next episode. Take care, everybody.
If you have been affected by any of the topics discussed in this episode, please reach out to the European Sickle Cell Federation so we can signpost you to the relevant support services in your country. Our email address is office@escfederation.eu.